Hi everyone, welcome to another episode of Just-in-Time Education, a podcast for healthcare HR from Lean Human Capital and Healthcare Source. My name's Rebecca McNeil and I'm the Senior Education Manager at Healthcare Source. Last week I was able to listen in to the Lean Human Capital 2013 Healthcare Recruitment Metrics Benchmark Study webinar. I have my co-host David Szary, founder of Lean Human Capital and the Recruiter Academy, with me to discuss those study results. Hi, David.
Hello, Rebecca.
So, David, let me give our audience a little background on the survey. I understand this was the fourth year that Lean has conducted the survey, and over 300 hospitals participated from over 185 facilities. I even saw that some Healthcare Source clients participated, such as Scottsdale Healthcare, Indiana University Health, Akron Children's Hospital, Rush University Medical Center, and Cleveland Clinic. Tell me, David, how did you go about gathering the data from this study?
We're actually very proud of that. A lot of studies, you go into a portal and enter your data. We take a white glove handling of the data, and it's really a four-step methodology of gathering it. We have each participant really understand the data and, most importantly, the definitions. Then they provide their data through a portal. But the most significant piece is that we actually literally meet with them via the phone and go through the data to make sure that we understand it correctly, that they pulled it correctly, et cetera. So obviously the significance there is making sure that we have accurate data so that, that the benchmark is credible for the participants.
Great. And in this study, what were some of the measures you were looking at?
It's all related to two things. One, based on the strategic objectives of the health system, right? We know there's some definite trends even through the studies that you guys have put together. So strategic objectives of the health system, number one, and number two, listening to the voice of the customer. I mean, data's there to be able to quantify return on investment, drive performance improvement, and to celebrate our success. So the areas that we have gathered data is related to cost, productivity, responsiveness, quality of hire, quality of service, and then lastly, process efficiency.
Great. Now, besides time to fill, which we're going to talk about in part 2 of our podcast, were there any particular results that were surprising to you, and if so, why?
I would say process efficiency is always one, because we look at how many applicants and how many candidates that the recruiters must process to fill one position. And then you extrapolate that over how many positions they fill, whether it's 500 or 5,000. And there's just a lot of waste and wait time in our staffing processes holistically as we look at it. So I wouldn't say I just am amazed at how much work folks are doing and how much more efficient they can be. That'd be probably number one. Number two, I would say, is that we did start to see a creep in the vacancy rates, which I think we expected with the market, improving, unemployment rates coming down. So the second one that I expected, but it's now kind of showing its ugly head, if you will, is that vacancy rates are starting to go up, which is problematic for all health systems.
Right. Well, that is interesting. Now, you spoke about Healthcare Source and the studies that we do, and thank you so much for mentioning the Healthcare Source and ASHA HR Initiative survey during your webinar. According to that survey, 80% of the respondents said they want to use retention to cut costs. So improve retention, cut costs. How does that align with the healthcare organization's larger strategic objectives?
Well, I think tongue and groove, quite honestly, the two biggest strategic objectives we keep hearing as we crisscross the country is, one, cutting costs, as you mentioned. So just right there, if you can cut retention, you cut turnover costs associated with rehiring folks, retraining them, and bringing them on board, and any lost productivity associated with retention. The second one, though, and as you guys know and have done a lot of work on, is increasing HCAP scores. So most healthcare organizations are trying to cut costs and improve HCAPs to make sure that they're monetizing the reimbursement dollars. And clearly, when you look at retention rates, if you're keeping high-quality people, arguably that's going to improve retention or improve HCAPs. But I want to make a point here, because we do track 90-day turnover in our study, first-year turnover. Most everyone tracks annual turnover rates. These are all good metrics to look at, but I'm a much bigger believer in I think, some leading edge metrics on are we retaining our high potential employees? So when we look at retention rates, we highly recommend that you're measuring retention of high potential employees. So really looking at these people are leaving. Quite honestly, as you know, Rebecca, some people leaving the organizations, it's not a bad thing if they're a low or mediocre performer. So just because you have low retention rates does not mean you got a high quality workforce, because you could have a lot of mediocre or low performers staying. So we're a big believer in, if you're going to look at retention rates, look at those retention rates of high performers. And if those people are leaving, you got a problem, because that's going to impact quality, which is going to impact that strategic objective, improving HCAHPS scores and monetizing reimbursement dollars.
Yep, it makes a lot of sense. And you have to look at the data, big picture, but also small picture, and see what the data actually means. So I think that's a really good point, and something we'll talk about more in part 2. So thanks for listening in today. Be sure to stay tuned for part 2. In part 2, David and I will discuss why speed and efficiency matters in healthcare recruitment, and we'll share some specific results from the Lean Human Capital Healthcare Recruitment Metrics Benchmark Study. Until next time, stay tuned.